Imagine stepping outside on a scorching day, the kind where the air just feels heavy and the sun is relentless. Now, imagine that's not your day off at the beach, that's your actual work day.
Yeah.
For billions, and I mean billions of people around the globe, this is becoming an increasingly common and frankly dangerous reality. We're talking about the escalating threat of heat stress in our workplaces. And this isn't just about feeling a bit uncomfortable. It's a critical health and economic challenge, and it's being intensified by climate change. And today, we're diving into a crucial new technical report and guidance. It's from the World Health Organization and the World Meteorological Organization, just out in 2025, and it really shines a stark light on this issue.
Yeah, and what makes this report particularly significant, I think, is that it's not just, new guidance. It's a comprehensive overhaul of a landmark WHO document that dates all the way back to 1969.
Wow, 1969, that's quite a gap.
Exactly. And the fact that it needed such a thorough revision after, over 50 years, it just underscores how dramatically the whole landscape of occupational heat stress has shifted, especially with 2024 being reported as the warmest year on record. It's a clear signal. This isn't some niche concern anymore. It's a rapidly evolving global crisis that demands our attention.
Right. So our mission today is to kind of cut through the noise. We're going to explore what this rising heat actually means for workers. Their immediate health, yeah, but also their long-term well-being, and even the stability of the global economy. We'll look at who is most at risk, the specific health challenges they're facing, and crucially, what can actually be done to protect them. We're talking everything from individual actions right up to large-scale coordinated programs. So this deep dive is your shortcut to getting properly informed on a truly critical, evolving challenge, straight from the latest science and health guidance. The numbers in this report, they really hit home. They reveal a scale of exposure that might genuinely surprise you. Can you walk us through just how prevalent this problem is?
Absolutely. I mean, the International Labor Organization, the ILO, they estimate that over 2.4 billion workers globally are already exposed to excessive heat.
2.4 billion.
Billion, yeah. To put that into perspective, that's nearly 3/4 of the entire global workforce. It's just an astonishing figure. Really highlights how widespread this issue already is.
And the human cost. It's not theoretical, it's devastatingly real. Annually, the report points to millions of occupational injuries, nearly 19,000 fatalities,
19,000.
and over 2 million healthy years of life lost just due to disability. It's a stark insight into the immediate, profound impact heat stress has. And it's not just those cute events either. Think about this. In 2020 alone, an estimated 26.2 million people were living with chronic kidney disease directly attributable to this problem.
Yeah, and if we connect this to the bigger picture, these aren't just individual tragedies, as awful as they are. This has significant economic ripple effects. The report notes a productivity decrease of about 2 to 3% for every single degree Celsius increase beyond 20 degrees C in wet bulb globe temperature, or WBGT.
Okay, let's pause on WBGT for a sec. That's not just the air temperature we see on the news, right?
Exactly right. WBGT is crucial because it factors in not just temperature, but also humidity, wind speed, and even thermal radiation. So it gives us a much clearer picture of how heat truly feels to a working body, how much stress it's putting on you. So this productivity drop, it isn't just about discomfort, it's about significant economic impacts, especially hitting hard in sectors like agriculture, construction, fishing, sectors that really rely on manual labor, and that drives poverty and socioeconomic inequality. It's all interconnected.
And unfortunately, looking ahead, the projections suggest it's only going to get warmer. The IPCC, that's the Intergovernmental Panel on Climate Change, they project that even in, let's say, optimistic scenarios like RCP 4.5, which aims to keep global warming below 2 degrees Celsius, even then, around 318 million people will be exposed to high heat stress by the end of the century.
300 million, even in the optimistic view.
Right. And if we stick to current policies, sort of middle of the road under RCP 6.0, that number jumps to 540 million. And then there's the business as usual scenario, RCP 8.5, where emissions just keep going up. Well, it's projected to be over 1 billion people exposed. That's a massive wave of heat heading our way, impacting regions far beyond the tropics, think mid-latitudes, Central North America, Europe. So what does this rising heat actually physically do to our bodies? Our core body temperature is incredibly finely tuned. It likes to stay in this really narrow window, right around 37 degrees Celsius or 98.6 Fahrenheit. But when you add a hot environment plus the demands of physical work, that balance gets, well, easily disturbed. Our bodies accumulate heat, from our own metabolism, sure, but also from the surrounding environment, even from the clothes we wear. This is what the report calls workplace heat stress. And it causes physiological heat strain, which is basically your body's internal struggle to cope, to maintain its ideal temperature when it's fighting external heat and physical exertion.
And this raises a really important question. How does the body try to cope with that struggle? Well, the primary mechanism, the main way we lose heat, is through sweat evaporation. That's key. But if the humidity is high, there's nowhere for the sweat to evaporate to. Or if workers are wearing insulating or impermeable clothing, think about certain types of PPE, that crucial cooling process is severely undermined.
So the body can't cool itself effectively.
Exactly. And it tries to compensate. It redirects blood flow to the skin, trying to get the heat out.
Yeah.
But that can unfortunately starve the working muscles, essential organs, even the brain, of the blood flow they need. And that leads to this cascade of problems. The report details a whole spectrum of health outcomes. It goes from milder but still impactful conditions to severe, genuinely life-threatening illnesses. So on the milder end, you see things like heat fatigue. This is sort of a transient state where physical effort just feels much, much harder. It reduces performance, increases accident risk. Miliaria, you might know it as heat rash. It's a common skin disorder from blocked sweat ducts, especially in hot, humid conditions. Sounds minor, maybe, but it's a clear sign your body's cooling system is under stress.
Right, like a warning light.
Precisely. Then there's heat syncope. That's dizziness or fainting, often due to a temporary lack of blood flow to the brain, maybe triggered by standing up too quickly or just standing for too long in the heat. And heat cramps or edema. These are those painful muscle spasms or swelling in your hands and feet, often linked to dehydration and losing electrolytes through sweat. But then you get into the really serious heat illnesses, heat exhaustion. This isn't one single thing, it's more of a spectrum of increasing severity. It's characterized by cardiovascular problems, dehydration, and potentially hyperthermia. That's a core body temp hitting 39 degrees Celsius or more. If you don't deal with it, it can lead to organ damage. And that's distinct from heat stroke. Very distinct, and much more dangerous. Heat stroke is a life-threatening emergency. It's defined by profound central nervous system dysfunction. We're talking disorientation, seizures, even coma, combined with severe hyperthermia, typically 40 degrees Celsius or higher. And often, multi-organ damage comes with it. It's also crucial to distinguish between classic heat stroke, which you often see in older people during heat waves, and exertional heat stroke, common in younger, otherwise healthy people doing intense physical work.
That's a vital distinction.
Absolutely. And finally, fluid and electrolyte imbalances. These are critical. It's not just basic dehydration or hypohydration, as the report calls it, which is just not taking in enough fluid. The report also flags the dangers of hypernatremia, that's high sodium levels, and especially hyponatremia, dangerously low sodium levels. This can actually be fatal if it's mismanaged, maybe by drinking too much plain water without replacing electrolytes. Repeated vomiting is a key danger sign for hyponatremia.
And it's not just these acute, immediate emergencies we need to worry about, is it? The report digs into the long-term risks for people who've survived heat stroke. It details a significantly higher risk of ischemic heart disease, like 2.2 times higher, and other cardiovascular diseases, about 1.7 times higher, showing up within 30 years.
That's a long shadow.
It really is. And what about mental health? Working in heat increases fatigue, irritability. It can impair judgment and concentration by around 10%. That directly impacts safety on the job, but also productivity. It creates this ripple effect that goes way beyond just the physical symptoms. Hashtag, who is most at risk and why? So when the heat really cranks up, who are we talking about here? Who is truly the most vulnerable? You might immediately think of outdoor workers. And yeah, you'd be right. Agriculture, construction, those are undeniably high-risk jobs. But the report makes it clear this is a more nuanced picture, doesn't it? It extends beyond just being outside.
Exactly. What's fascinating here is the combination of factors that elevate risk. It's not just about the job itself, it's also about the individual. Lack of heat acclimatization, for instance. That's your body's ability to adapt over time to hot conditions. It's a major factor. If you're not used to the heat, you're much more vulnerable. Low physical fitness, already being dehydrated, older age, having a high body mass index, underlying medical conditions like heart disease or diabetes, all these can significantly increase vulnerability.
Even medications can play a role.
Yeah, even certain medications, things like anticholinergics or diuretics, they can interfere with the body's natural cooling mechanisms. But here's the thing, even young, healthy, fit individuals who are heat acclimatized can still be at serious risk, especially if they're doing successive days of really strenuous work without enough time for proper recovery. The strain just builds up.
That makes so much sense. It's cumulative. And the report specifically highlights some populations that maybe don't get enough attention. What about international migrant workers?
That's a really critical point.
Yeah.
Migrant workers, while often younger and perhaps healthier when they arrive, typically have less experience with the specific hazards, maybe poorer risk perception. Crucially, they're often unacclimatized to the local heat conditions. And they're also more likely to be in those very physically demanding outdoor jobs. There was a study mentioned in Cyprus that found migrant farm workers actually experienced higher heat stress, partly because they took fewer breaks and tended to wear more clothing, maybe for cultural reasons or just lack of appropriate gear. These are often forgotten elements when policies are made, and it really underscores the need for tailored interventions for different groups.
Absolutely. And then there are the environmental factors that can add these layers of unexpected risk, like working in direct sun, for instance. That simple difference can increase that crucial WBGT measure by 2 or 3 degrees Celsius compared to working in the shade. That's significant.
Huge difference.
But even at night, you mentioned urban heat islands. They can keep temperatures stubbornly high. So nighttime construction work, which sounds like a good idea, can actually be unexpectedly risky because of all the heat stored and radiating from asphalt, which can get over 60 Celsius, believe it or not, or from machinery running nearby.
Right, that stored heat is a real issue.
Plus, think about the protective clothing we rely on in many jobs, like hazmat suits or even the full PPE people wore during pandemics like COVID-19 or Ebola. That gear, while necessary for one hazard, can severely restrict the body's ability to cool itself. It can turn a task that seems safe in normal clothes into a really high-risk one just because of the heat buildup inside the suit.
Yeah, and if we connect this to the bigger picture, workers rarely face just one hazard at a time. Workplace heat stress can often be what we call a compound hazard. For example, when you're hot, you tend to breathe faster and deeper. If you're also exposed to air pollutants or dust, that increased respiratory rate means you inhale more of those harmful substances. It intensifies the overall health risk. The report really emphasizes that you need a comprehensive risk framework. You have to account for these dangerous synergies between different hazards.
Okay, so with all these inherent risks and the fact that they're accelerating, what can we actually do about it? This feels overwhelming. The report makes it crystal clear that general public heat health warnings, the kind we might see on the weather forecast, while valuable, they just aren't enough for workers. They don't capture the specific risks of the job. We need specifically designed occupational heat action programs, or OHAPs.
Exactly. And what's fascinating here, and really important, is the emphasis on collaboration in creating these OHAPs. They aren't meant to be just top-down mandates from management. The guidance stresses they should be co-created.
Co-created.
Being developed with managers, employers, workers and their representatives, trade unions, health and safety experts, even local authorities. Everyone needs a seat at the table. This ensures the plans aren't just effective on paper, but they're also practically feasible, economically viable, and environmentally sustainable when you try to implement them in the real world. It helps address disagreements or power imbalances early on.
That makes sense. So it's a buy-in process. The report lays out this comprehensive roadmap outlining 6 key elements for these plans. There's a prevention policy, a heat acclimatization plan, environmental surveillance, keeping an eye on conditions, medical monitoring, training, and hydration protocols, and a really robust emergency response plan. And it's all tailored to specific job controls. It feels like a truly holistic approach. Okay, let's unpack some of those real-world actions using that hierarchy of controls approach, starting with the most effective, engineering controls. This is about changing the actual environment.
That's the goal, the most protective level.
So things like air conditioning where possible, obviously. Increased ventilation, localized cooling systems like maybe designated cold rooms or those evaporative coolers, sometimes called swamp coolers. Even just simple water sprays paired with fans can make a difference. It could also mean using reflective shields to block heat radiating from machinery or looking at automation for the most physically demanding tasks to reduce the human heat load. The report even mentions new tech like solar-powered AC or these special radiative cooling panels as more sustainable options coming down the line.
Yeah, lots of innovation happening there. And building on that, the next level is administrative controls. This is about changing how people work within the existing environment.
Okay, like what?
Well, strategies like job rotation, moving workers between hotter and cooler areas, rescheduling the most strenuous tasks to cooler parts of the day or even night. But again, keeping that urban heat island effect in mind. Structured work-rest cycles are absolutely crucial, making sure people have mandated breaks in cool areas, and empowering workers to self-pace where possible, letting them adjust their effort based on how they feel. Implementing a buddy system is also vital, having workers look out for each other, monitoring for signs of heat stress. It builds that culture of safety.
And that links directly to, personal actions, but actions that need employer support, right?
Absolutely. Training and awareness are paramount here. Teaching workers and supervisors to recognize the symptoms of heat illness in themselves and others, helping them understand their hydration needs, maybe using simple visual aids like urine color charts posted right there in the workplace toilets. It sounds basic, but it works. And knowing basic first aid steps. And critically, employers must ensure easy access to cool, drinkable water and fluids that contain electrolytes, not just plain water, especially for heavy sweating jobs. Plus, having adequate hygiene facilities, places to cool down. This isn't just a nice to have. The report frames it as a fundamental health imperative.
Couldn't agree more. And crucially, if things do go wrong despite prevention efforts, having a clear, practiced emergency response plan is vital.
Life-savingly vital. This means immediate aggressive cooling for severe heat illnesses, like heat stroke. We're talking things like ice water immersion if possible, or cold water dousing. The goal is to lower that core body temperature below 39 degrees Celsius within 30 minutes of the person collapsing. The report grimly highlights that any delay in those critical first response minutes can literally be fatal. There's no time to waste.
Right, so we know the risks, we know the strategies, but how do we actually know when the risk is too high in a specific workplace on a specific day? How do we measure this heat stress effectively? The report describes several methods, kind of moving from qualitative gut feelings to more precise quantitative tools.
Yeah, what's interesting is that it often starts pretty simply, with a professional judgment, basically. A shared agreement among workers and employers about whether a workplace feels hot, or if there are early warning signs like people sweating excessively, or maybe fatigue seems higher than usual, or even if accident rates are ticking up on hot days. If the answer to simple questions like, are workers obviously sweating a lot, or are mistakes or accidents increasing, is yes, that alone should trigger a deeper look, maybe a more formal assessment and potentially implementing an OHAP.
Okay, so start with observation and common sense. Then what?
Then we move to the quantitative methods, the actual measurements. The wet bulb globe temperature, or WBGT, is probably the most widely recognized and recommended for occupational settings. As we mentioned, it combines temperature, humidity, wind speed, and thermal radiation. It essentially gives you a single number representing the environment's maximum ability to let sweat evaporate and cool you down. And crucially, the safe WBGT thresholds, the recommended limits, they decrease as the work gets more intense. And they're higher for people who are properly acclimatized. And things like clothing make a huge difference. Wearing those vapor barrier coveralls we talked about, that can effectively add 10 degrees Celsius to the WBGT value your body actually experiences. 10 degrees, wow. Okay, what else? Well, there's another sophisticated index called the Universal Thermal Climate Index, or UTCI. This one uses a complex model of how the human body actually perceives temperature. It integrates all the environmental factors and even includes an adaptive clothing model. It's very accurate for many outdoor public situations, but it can have limitations in specific workplaces where clothing choices are fixed, like with uniforms or PPE, or where work intensity is really high and sustained. You might also encounter the heat index, which you often see in public weather forecasts or on phone apps. It basically combines air temperature and humidity. But it doesn't directly account for sunshine, that's solar radiation, which effectively adds about 3.5 degrees Celsius to the value you feel, and it doesn't factor in airflow directly either. So generally, WBGT is considered more comprehensive and useful for workplace assessments.
Got it. WBGT is kind of the gold standard for work.
For many situations, yes. And then there's the predicted heat strain, or PHS model. This one is particularly valuable, though more complex to use. It's defined in an ISO standard, IS 7933.2023. What it does is actually estimate how much your core body temperature is likely to rise, how much total water you're likely to lose through sweat, and crucially, the time until critical limits are reached. So it accounts for the duration of work in specific conditions. It essentially tells you, okay, under these conditions, doing this task, wearing this clothing, you can safely work for X amount of time before your body hits a critical limit, and you'll likely need Y amount of water. It's complex, yeah, but there's specialized software available to help employers use it.
That PHS model really paints a vivid picture, doesn't it? Just to give people a real sense of this. Imagine that construction worker, again, shoveling gravel, doing heavy intensity work. On a typical cool autumn day, maybe their body temperature doesn't exceed 37.8 Celsius, and they need about 3 liters of fluid over their shift. Manageable. But take that same worker, same job, on a very hot summer day. maybe 39 degrees Celsius air temperature, high humidity. According to the PHS calculator examples in the report, their core body temperature could shoot past 38 degrees Celsius within just 1 hour.
Hour.
Yeah, requiring them to drastically reduce their work rate or take very frequent long breaks. And they might need nearly 10.5 liters of fluid over an 8-hour shift to stay safe. That's a huge, huge difference. It makes it so clear how quickly conditions can become unsustainable and genuinely dangerous.
Absolutely. And beyond just that initial assessment, monitoring the actual physiological heat strain in workers is also important in high-risk situations. Things like heart rate, core body temperature, which can be measured more accurately with oral thermometers, or even those ingestible gastrointestinal sensor pills and tracking sweat loss, perhaps using those urine color charts we mentioned. These can all be monitored, but they often require specialized equipment, training, and expertise to interpret correctly. However, this is an area where technology is really making strides. There's an EU-funded project mentioned called Heat Shield. It's the first web-based platform providing short-term, weekly, and even long-term monthly heat warnings specifically for workers across Europe, along with customized mitigation strategies. And various smartphone apps are becoming available now too, like the Oceanios heat safety tool in the US that can give workers real-time information about the current heat stress level and suggest protective measures. #outro.
So, wrapping all this up, what does this really mean for us? Workplace heat stress isn't just some future challenge. It's a rapidly growing crisis right now, impacting billions of lives and livelihoods across the entire globe. We've seen how climate change is turning up the thermostat, how heat impacts our bodies from just feeling tired all the way to life-threatening heat stroke. We've talked about who's most vulnerable and the absolutely vital role of these comprehensive occupational heat action programs in protecting workers.
Yeah, I think if we connect this to the bigger picture, the guidance makes it really clear. Reversing these dangerous trends requires a collective effort. It needs public consensus and, crucially, public investment in interventions. Interventions that are affordable, that are cost-effective, and that are based on the best available evidence, like what's in this report. From policymakers designing those comprehensive OHAPs at a national or regional level, to employers implementing practical engineering and administrative controls on the ground, right down to workers practicing self-protection, staying hydrated, and using those buddy systems to look out for each other. Every single level has a critical role to play. Our health, our economies, really the very fabric of our working lives depends on how effectively we rise to meet this escalating heat challenge.
It really does. And maybe here's something to consider as we finish. As global temperatures continue their upward climb, how might our fundamental definitions of decent work and what constitutes a safe working environment need to shift? How do we ensure that everyone, everywhere, can earn a living without risking their life, even when they're working in the shade on a hot day? What does true climate action really look like when we bring it into the workplace? Something for you to think about.
This audio is for informational purposes only and should not be considered medical advice. Please consult a qualified healthcare professional for personalized guidance.